Hey guys, Dr. Roach here with the Modern Image Orlando. We are a Central Florida cool sculpting leader. Sitting here with Chad Pitt, 1019 amp radio.
Yes.
We're going to answer some questions for you that we get a lot about cool sculpting so we can clear up some of the burning questions that you all have about this cool procedure.
I got a lot of questions for you.
And we'll just go ahead and get started. So, Chad, I know you had come in recently, and we kind of went through this thing, and we thought this would be beneficial to, get a lot of people's questions answered before they come in, so they kind of know what to expect. So, if you just want to rattle off a few, I can run through some answers for you.
Yeah. I think the biggest question is, does it hurt?
Most of the time, there's really no discomfort with it at all. The machine itself is like a giant vacuum freezer. So when we put the template, the treatment heads on, it's got a cooling to a negative 10 degrees Celsius. So that's going to make the tissue kind of numb. Now another question we get a lot is that does it hurt any of the tissue in there? No. The technology is designed to only damage, which what we want is the fat cells, and kill them in a natural way, as opposed to a traumatic cell death like a liposuction type procedure. So there can be a little bit of discomfort and some numbing feeling that people feel, but overall there's really no pain associated with it, no downtime, nothing like that.
So where do the fat cells go once they die off?
Good question. So the immune system in your body has these little things that are called macrophages. They're like little basically Pac-Man guys that go around and they eat up all the debris and the dead tissue, and then that goes out through the different waste systems and the lymph and stuff in the body. So it just goes out through a natural process. It's already there in the body.
Okay, I guess another question is, depending on how many areas you get done, I mean, is it costly?
It's a really tough question to answer because everybody has a different distribution of the tissue that they're trying to treat or make look better or minimize. It is a body contouring procedure as opposed to more of what people think is like a fat loss procedure. So you have to take literally a look at each person, and I like to say, if you can squeeze it, we can freeze it.
Right.
Our office is, fortunate enough to have a bunch of machines, and we have the original technology and the newer technology.
Right.
So we're able to customize programs for people to get at those little areas that they're having a stubborn time with, no matter how many sit-ups they do or how many salads they eat. This is exactly what it's for, is to help minimize that. So what we try to do is create realistic treatment plans for folks based on what they have, based on what their goals are, and then we'll lay out a timeline and just come into agreement on what's going to be the best protocol for you. There's different prices for each treatment head that we do and each area that we put a treatment head. So, it's a cosmetic procedure, so, you're going to be spending a little bit of money, but definitely cost effective, and, people get great results.
But it's long term, so once the fat cell is dead, it's not going to go back to that spot. Like if I eat, fat's not going to go back in that area, correct?
For the most part, no.
Right.
What it does is each time we do a treatment on an area, it can decrease the fat cells in the area about 25%. And what we found is that you can do a second treatment on the same area and get a further 25% reduction of what's there.
Okay.
But this differs from liposuction because liposuction is going to take out all the tissue that's in the area, so that if you ever have to deposit fat into an area again, it's going to go to somewhere you don't want. Like a lot of people get a back fat or a bra fat or under their chins. And with this, if they do deposit some fat back in the area, it's still looking like a normal contoured, aesthetically pleasing body, which is what we're going for in the first place.
But if I'm looking for something that's non-invasive with no downtime, this is what I want, correct? Instead of getting liposuction done, because obviously there's downtime with that.
This is absolutely the procedure that you're looking for. It's been, around for over 10 years. They've done millions of treatments worldwide. It's gaining popularity now. A lot of places are doing it. it's one of the things that we do primarily here. So, you know, we're focused on it every single day. We've got doctors on site. We're a certified practice. All my, you know, techs that are working on patients have had, you know, advanced training through Sculpting University, and not a lot of other offices do that. So
That was my next question, is that when I come here and get it done, I'm not just going to have a random person who just learned how to work a machine last week working on me. I have somebody who's actually a trained professional.
yeah, it's gonna be a trained professional. You know, all the plans are signed off by doctors and medical personnel, and then we carry out the programs of care, and all of our techs are, you know, highly trained and literally doing the procedure every day on patients.
In this procedure is FDA cleared, correct?
It's FDA cleared. You know, there's going to be no downtime. There's going to be really no pain or anything that people get from it. I've had, you know, some patients report that they've had some bruising from doing it, you know, a week or two afterwards. I've had some people tell me they've had some numbness in the areas that they've treated. And we expect that because you're, you know, literally freezing the area. It's going to numb out the nerves, but it all comes back. It all, you know, regenerates except the fat, which we want to get rid of.
Right. I guess the last question I have is that once I get the procedure done once, how long does it take before I see any results?
So everybody's a little bit different, but based on, you know, the research and what we've seen is people can typically start to see a result anywhere from about 3 to 4 weeks, but you don't really start to see maximum, you know, changes probably about 2 to 3 months down the road.
Okay.
And some people, when they come in, we're going to recommend, like if they've got a lot of lower abdomen fat that they want to get rid of, we may say, hey, we're going to do one treatment today, we're going to wait 30 days, you come back in, we'll reassess, get some pictures. We may do a second treatment on that area. So in that case, it spreads out your plan to 4 months until you see your maximum result.
Gotcha. Cool. Thank you, Dr. Roach.
You got it,
Appreciate
man.
Looking forward
My
to it.
pleasure.